Hey, this is our Cranial Nerves assignment.
I'm Abby Tucker.
And my name is Cameron Harris.
So for our assignment, we decided to do a puzzle. On the first puzzle that you see 12 pictures that represent the cranial nerve and what it would look like if there was a lesion on the nerve. On the second puzzle is the name of the nerve, what it carries, and a short synopsis of its function. So the first nerve we're going to talk about is the olfactory nerve. The function of this nerve is the sense of smell. It carries sensory nerves. It has chemoreceptors in the nose that send olfactory messages to the inferior frontal lobes. This information then travels from the olfactory bulb down the olfactory cranial nerve to the hippocampal formation in the temporal lobe. The hippocampus is responsible for long-term storage of odor memories. The second nerve is the optic nerve. This nerve is responsible for vision accuracy of sight, pupillary reflexes, awareness of light and dark, and the orientation of head and eye movements. It also carries sensory nerves. The rods and cones of the retina send visual information down the optic nerves to the optic chiasma. This information then travels from the optic chiasma through the optic tracts. Once in the optic tracts, it travels to the lateral geniculate bodies of the thalamus. From there, it goes to the superior colliculi of the midbrain. This is for an unconscious level of vision. It then travels to the occipital lobes for visual detection and interpretation. The third nerve is the oculomotor nerve. This function is for movement of the eyeball up, down, medially, and laterally, and downward deviation. It also moves the eyelid, and is responsible for pupil constriction. This nerve carries motor neurons. The oculomotor nerve begins in the oculomotor and integer Westphal nuclei in the midbrain. It runs anterior through the cavernous sinus, through the superior orbital fissure into the orbit. Some lesion symptoms would be lateral strabismus. The eyeball deviates outward because the medial rectus is lost. The fourth cranial nerve is the trochlear nerve. It is responsible for downward and lateral eyeball movements. It also has motor neurons. This nerve arises from the trochlear nucleus of the brain, emerging from the posterior aspect of the midbrain. It runs anteriorly and inferiorly within the subarachnoid space before piercing the dura mater adjacent to the posterior clinoid process of the sphenoid bone. It then moves along the lateral wall of the cavernous sinus before entering the orbit of the eye via the superior orbital fissure. Some lesion symptoms of cranial nerve number 4, trochlear nerve, is that the patient will have difficulty moving the eyeball down and lateral. Nerve number 5, trigeminal nerve, functions by mediating sensation of the face, head, cornea of the eye, and inner cavity. Sensations include pain, temperature, and discriminative touch. The motor part of this innervates the jaw muscles that control chewing. Like I said a minute ago, it has sensory and motor neurons. At the level of the pons, the sensory nuclei merge to form a sensory root. From this sensory root, it expands into the trigeminal ganglion. From the trigeminal ganglion, it arises into 3 divisions: the ophthalmic, maxillary, and mandibular. The sixth cranial nerve is the abducens nerve. It is responsible for lateral deviation of the eyeball. It has motor neurons. This nerve arises from the abducens nucleus in the pons of the brainstem. It exits the brainstem at the junction of the pons and medulla. It then enters the subarachnoid space and pierces the dura mater to travel in an area known as Dorello's canal. Once it leaves Dorello's canal, it enters the cavernous sinus. It travels through the sinus and enters the bony orbit via the superior orbital fissure. Within the bony orbit, the decumbens nerve terminates by innervating the lateral rectus muscle. Some lesion symptoms would be medial strabismus, and it can cause double vision or diploma nystagmus. The cranial nerve number 7 is the facial nerve. This has both sensory and motor neurons. The sensory innervates taste receptors on the anterior tongue. The motor innervates muscles of the facial expression, muscles for eyelid closing, and trapezius muscles. This has two different pathways. The intracranial, which arises in the pons, it begins as two roots, a large motor root and a small sensory root. The two roots travel through the internal acoustic meatus. It then leaves the internal acoustic meatus and enters the facial canal. In the facial canal, many things happen. First, the roots fuse to form the facial nerve. Next, the nerve forms the geniculate ganglion. Lastly, the nerve gives rise to the greater pectoral nerve, the nerve to the trapezius, and the chorda tympana.
Next, we have cranial nerve number 8, the vestibular cochlear nerve. So its function is the main auditory branch which transmits sensory impulses that result from vibrations of the fluid in the cochlea. Vestibular branches also receive sensory stimulation from the semicircular canals of the inner ear. It is concerned with balance and the sensations of vertigo. The function of the vestibular branch are balance, equilibrium, and the position in head space. It carries two sensory branches. The pathways for this nerve include the auditory branch of the vestibular cochlear nerve runs from the hair cells of the organ of the corti and to the vestibular nucleus of the brainstem. The vestibular branch runs from the semicircular canals, utricles, to the saccules, to the vestibular nuclei, and to the brainstem. The semicircular canals, utricles, and the saccules detect changes in head position. The glossopharyngeal nerve function for sensory has taste on the posterior aspect of the tongue, and the motor part contains swallowing. It carries the sensory and motor nerve. The pathway for the glossopharyngeal nerve originates in the medulla oblongata of the brain. The nerve leaves from the cranium via the jugular foramen, and at this point, the tympanic nerve arises. It has mixed sensory and parasympathetic composition. The glossopharyngeal nerve descends down the neck anterolaterally to the internal carotid artery. At the inferior margin of the styloid pharyngeus, several branches arise to provide motor innervation of the muscle. It also gives rise to the carotid sinus nerve. The nerve enters the pharynx by passing between the superior and middle pharyngeal constrictors. Within the pharynx, it terminates by dividing into several branches: lingual, tonsils, and pharyngeal. Next, we have the vagus nerve, number 10. The functions of the vagus nerve for the visceral branch includes carrying sensory and motor information. Sensory carries taste information from the palate to the esophagus. The motor carries parasympathetic information to and from the heart, pulmonary system, esophagus, and the GI tract. The skeletal system branches carries motor information to the muscles of the larynx, pharynx, and upper esophagus, responsible for swallowing and speaking. Vagus nerve number 10 carries sensory and motor. The pathway for the vagus nerve includes in the head. The vagus nerve originates from the medulla of the brainstem. It exits the cranium via the jugular notch within the glossopharyngeal and accessory nerve. Next, we have cranial nerve number 11, the accessory nerve. This contains two roots, the cranial nerve root and the spinal nerve roots. The functions of the accessory nerve number 11, the cranial nerve root controls elevations of the larynx during swallowing. The spinal nerve root innervates the sternocleidomastoid muscle, which allows for function of the head to rotate and contralateral sides, head and flexion and extension. Innervation of the upper trap muscle allows for shoulder elevation and shoulder flexion about 98 degrees. Finally, we have cranial nerve number 12, hypoglossal nerve. This is innervated by the functions is innervated by the muscles of the tongue. The glossal nerve is responsible for tongue movement. It is innervated by motor nerves. The pathway for the hypoglossal nerve arises from the hypoglossal nucleus in the medulla oblongata of the brainstem. There we have all 12 cranial nerves.
We hope you enjoyed our presentation. Have a good day.